Dr. Johnson just a moment ago talk about how incarceration is the most expensive and least effective treatment for the folks who are struggling with mental illness. Yet it seems that a lot of people end up in the criminal justice system. Are there enough diversion programs? My guess is not at the moment. And if not, what would you like to see happen? What could happen in the short term to try to address some of this?
Yes. Clearly, what we're doing is not working here in Hawaii, but this is all over the country. And so when people are in crisis in the community due to a behavioral health condition, it's very likely that they will encounter a law enforcement official who then becomes a first responder. And then the issue is, what do you do at that point? What are the opportunities to do something different? So as I mentioned before, without good solutions in the community, a person with serious mental illness is 10 times more likely to go to jail than they would to a hospital to address the things that they're struggling with. And Director Johnson mentioned that that is the most costly, less effective, or least effective solution that we could have to address these particular challenges. And so the solutions are going to involve upstream, improving the crisis space and programs that are available to people who are in crisis, and then also build the opportunities for people to off-ramp from those points of crisis into care and support in the community as an off-ramp off the justice system pathway. So what we see is there's a continuum, and this helps us understand the challenge, but also build solutions. And it goes from being in crisis in the community to interaction with law enforcement to being involved with the court system, and then further downstream to jail, or maybe even being sent to the Hawaii State Hospital. The reality is right now that at Hawaii State Hospital, as you discussed in the previous segment, 100% of the individuals sent there at this time are from the criminal justice system on criminal court orders, and we need to shift that paradigm.
When we talk about just even with that paradigm shift and transitioning into this type of care and response, there is also concern about just the availability of those mental health professionals in the field that are able to help with this need. And so while you're able to make this transition, does the state have enough personnel and people and experts in this field to help with what could be a wave of people needing help?
Yes, we're certainly seeing an ongoing need for people with mental health and behavioral health conditions to receive help all along the continuum. We need more, clearly, but we also need a shifted way that we approach things for people who are having behavioral health conditions. So it's really a two-pronged approach. One is building the programs that are going to be available to off-ramp people from this pathway, but the other is behavioral health professionals who are going to support them. In addition to that, having housing solutions that people can be stabilized in once they get off that pathway and are not ending up in jail or at the state hospital.
It feels like we are just sort of at the beginning of this process. How long does it take to actually create a kind of system that you're talking about? What's the runway, if you will, to get to where we need to be?
So it takes a while, and what we've seen in other states is the most important thing first is to develop aligned priorities and aligned commitment to start moving into change. And once you do that, it is incremental change over time, but you can see a big impact for standing up a program like a crisis center that's an alternative to an emergency department, that allows people to be bought in by law enforcement and linked with treatment in the community instead of going downstream into a jail or a prison or ultimately to the state hospital. And you can have a big impact pretty quickly on a community by building that resource and solution. And we're planning to develop one in urban Honolulu for that very purpose. So you can have impacts very, very soon in the short end, but in order to make the impact at every step along the way, including in the judiciary, including the state hospital, et cetera, it takes time. I mean, we're talking on the level of years to do that. But from my perspective, one of our fundamental challenges is we've been taking a criminal justice approach to a public health problem. And once we align around changing that paradigm, then we're going to